Rhizotomy is also called radiofrequency neurotomy, and what it is you put a cannula, which is a large needle, in to the spine and then pass an electrode through that cannula up against the nerve that transmits pain signals from the arthritic joints to the brain. And then you pass an electric current which cauterizes the nerve. So it doesn't do anything to eliminate the osteoarthritis, but it prevents pain signals from being transmitted from the arthritic joints to the brain. So it's purely to get rid of pain. The problem with rhizotomies is that hardly anybody knows what it is, and there's very limited access to it as well. Like in the States, people that have back pain often will get big fusion operations, but fusions probably have about a 50% success rate for eliminating back pain, and they can cause more problems, and it's a 3-month recovery time. Rhizotomy is just putting needles in, putting an electrode in, cauterizing nerves. It has a very good success rate, probably 80 or 90%. Most people get pain relief for 12 to 18 months, and then if the pain recurs when the nerve regenerates, you can repeat it. And it's usually just as effective. If it doesn't work, it doesn't cause complications. There's no real downtime. People recover within days or maximum a week or two. So the typical patient with back pain talks to the program coordinators. They take a good history on the phone to figure out what the person's problem is. So if somebody has predominantly back pain, we usually do recommend that they get an MRI because it shows us what the structure of their spine is. We spend an hour taking a history from the person, figure out when they have their pain, how bad it is, what aggravates it, what relieves it, what other treatment they've done, all that type of stuff. Do a physical examination to determine where their pain's at, if they have any signs of nerve involvement or spinal cord problems in that. And then we review all the imaging with the person, and based on our history and exam, we have a pretty good idea of where their pain's coming from. So then we typically would recommend that they undergo these diagnostic injections of local anesthetic when they're in pain, because then we can freeze the different structures and determine which ones are responsible for their pain. And if it is the facet joint or the sacroiliac joint, then we recommend doing a rhizotomy procedure because that cauterizes the nerves, takes away the pain from those joints, and then 80 or 90% of people are essentially pain-free for at least 12 to 18 months. Most people are able to get back to recreational activities like golfing and fishing, hiking, mountain biking, and back to work. So it's really a quality of life type of clinic. We get people back to enjoying their life again.